How can we effectively reduce the burden of disease caused by cholera and other waterborne infectious diseases in Haiti? There are countless organizations that are working tirelessly, some people that have amazing minds working towards this goal of reducing the burden of disease right now. And there are many people that are attempting to address this issue right now. And we feel that a lot of these organizations are not able to, the organizations that are not having as much of an effective time at reducing the incidence of cholera in these areas are having trouble rising up above other, out of this crowd of NGOs that we see in Haiti right now. And what we want to do is we want to be able to recognize, wow, Deep Springs International is having a great influence on the reducing the amount of cholera, reducing the amount of infectious disease, waterborne infectious disease in the community. Or Soil is having this great opportunity, is having this great work being done. And how can we find these organizations that are above the rest and really facilitate their needs and facilitate their process in finding communities and working with the government and working with the NEPA and also in connecting with donors. And that's where our idea starts.
Well, what's the main goal here? I think that in the wake of the outbreak of cholera in Haiti, there is an urgent need to begin the empowerment of the communities, local communities, so that we can influence behavioral changes, because this is necessary in order to reduce the incidence of cholera in Haiti. In order for us to do this, I think what we need to do is to develop a comprehensive, user-friendly database which can be a model that the government of Haiti will be used in order not only to allocate but also to monitor resources throughout the country. And this is very important. And we would hope that this kind of database could be housed at a local university. If you would like to, the local university, local student university to get involved in this process and things like that. So we realize that also that these particular resources can be used by non-profit organizations, corporations, higher education institutions throughout the United States and Canada and Europe, and so that this information can be conveyed to the general public so that they know exactly what we're talking about here. So at the end of the day, the goal is basically to provide the information, empower the local communities so that we can influence change, behavioral in the behavior of the people. And once we do that, I think that probably will help lower the incidence of cholera in Haiti.
Right, so we have this database, there's a problem we're trying to solve. You're probably wondering what data goes into that database. So the data that we're going to put in is an evaluation of the different organizations on the ground in Haiti, whether that means they're doing water sanitation, water sourcing, or public health. What we're going to do is we're going to be evaluating each of these organizations against key performance indicators. So for example, credibility, transparency, the scalability of the organization, and several other factors that we think are really important. What this will allow us to do is start to gauge where the organizations are doing well relative to one another, and for the communities, for the donors, for other people who are interested in accessing this database, they can get a kind of comprehensive view of which of those organizations best fit their needs.
So how this would work is we would have a field operator that would go to the local community, work with the leaders and try to identify their needs. And using the database that he just mentioned, we would come up with a list of different partner organizations that best fit their needs, that would be able to respond to them and go back to the community and say, here you go, you have the top 3, for example, organization, which one would fit you best? This tool would allow those partner organizations to also maximize impact and provide a mechanism for them to self-evaluation, so they could compare themselves to other organizations, how well they're doing and how effective they are within a certain region. And it would also help the local government to be better informed, have a better idea of what's needed in different regions, and given the information that we would have on these different organizations, try to match and send them to places where their services can be provided. And last, we could say that the database would be used as a guide for donors as far as where to invest their money. and looking at that information, who to put their money with.
So we also wanted to talk to you guys a little bit about our pilot plan for this and plan to bring it to scale. So I think the idea is we would begin by identifying a specific region within Haiti, so focusing in on not the entire country, but a specific region. Within that region, we pick a set of communities who have a high need for solutions to waterborne illnesses. Within those communities, we would identify leaders, community leaders who have sort of proactively said, we're really interested in being a part of this eradication effort. Because I think that's a big thing that we learned this weekend, is that there's actually a lot of people who are really interested in being a part of this effort. So identify those leaders. At the same time, we also obviously have to be building the database itself. So I think the first step is to work with a team of experts, analytic experts, people who know a lot about the issue in Haiti today, and who know a lot about the cultural sort of roadblocks that are continuing to make this issue real and prevalent there, to help us identify a set of key indicators, key metrics, and key indicators that we want to be measuring. So all the sort of metrics that Jake was talking about, and also the indicators. So what does success look like? Is it eradicated, like is it the rate of incidents going down in a given area? What are actually the things that we want to have as key outcomes? So identifying those metrics. The second piece will be to start to work and really collaborate with partner organizations to get information from them and have them data share, which we know is also a really big roadblock that I think people have tried to do that so far today, and that's something that will be difficult for us to do, but we really want to make sure that we go after strong data sources and quality information. Once we have those two pieces, we want to actually build the infrastructure for the database, put it together, find somewhere to house it, and begin to get it prepared for analyzing it so that when we actually go out to that first set of communities, we have a set of information to provide them. Also want to talk to you a little bit about how we're going to fund this and sort of long-term scale in terms of revenue. So in the short term, we really realize it's going to be about grant support and finding private donors to support this. I think for all the reasons we've talked about, we actually think there's good interest around that today. So I think that's our first step, is to sort of get it funded. In the long term, once the database has become credible, and we do think that that's like the key lever to getting this to be sustainable over time, is having it become a credible database, a credible set of indices. We want to go out and ask for subscription-based access to the database from partner organizations who want their name in there so that they can scale and actually drive impact, but also to get donor support, because we really do feel like this will be a huge resource for donors who want to find out the organizations to support that are having the best impact. So subscription-based. And then the second revenue model to support that as well is fees from consultative services, again, to donor organizations, to partner organizations who want to really leverage the information that they're getting to target and find a way to have impact. So thanks.